Hello, everyone. My name is Jean, and I work in the Community Relations Office here at York Hospital. And on behalf of all of us here at the hospital, I'd like to welcome you to this afternoon's webinar. We are so pleased that you're able to take time out of your day to join us as we introduce our new president and CEO, Dr. Patrick Taylor. We know that he's excited to get to know you, the members of our community, and hope that he shares his insights and plans about what he sees for the future of York Hospital, that it will allow you to get to know him a bit better as well. Now, simply so you know a little bit about what to expect over the next hour, our agenda will begin with a few housekeeping items, along with a brief video introduction. And then Dr. Taylor will take the reins for about 15 to 20 minutes to present, followed by what we hope is a robust question and answer session. Now, as promised, those few quick housekeeping notes to review. Unlike traditional Zoom, where you see everybody's faces during the meeting, during this webinar, you will only see the presenter and any relevant slides. As guests, your audio has been muted in order to minimize background noise. So if you find yourself experiencing audio issues, we suggest that you shut down the Zoom webinar and restart, as it's been our experience that this approach works best. As I mentioned earlier, there will be time for questions and answers following Dr. Taylor's remarks. So please feel free to submit your questions at any time during the presentation, and we will hold them until the Q&A. Please type them in using the Q&A button located at the bottom of your screen rather than the chat or raise hand icons that you may be used to, because those functions will not be monitored. Now, if you have a question that has not been answered during our time together, please feel free to email us directly at info@yorkhospital.com, and we'll be happy to send along a reply following our meeting. Now, today's program is being recorded and will be available on our York Hospital website and YouTube channel for viewing and listening next week. And we promise to email you as soon as the links become available. Now, I think that covers our presentation details. So before we hear from Dr. Taylor himself, please enjoy this brief video introduction.
My name is Dr. Patrick Taylor, and I'm proud to serve as the new president and CEO of York Hospital. I began my career as an emergency medicine physician at a healthcare system in Fort Lauderdale, Florida. During my 30-year tenure there, I progressed through various leadership roles, from ED director to CEO. That clinical background has been a real benefit. Interacting with patients and the teams who care for them keeps me connected to what patients and families go through on their healthcare journeys. I think it's important for our community to know that York Hospital embraces the changes before us. We are preparing to transform in order to meet both the evolving needs of our patients and our healthcare system. Through this journey, we remain dedicated to the highest standards of quality and safety. The confidence the community has placed in York Hospital is important to me personally, and with this strong foundation in place, we are poised to become preferred choice for healthcare in southern Maine and the Seacoast. We will continue to earn the trust of every patient every day, and our wonderful caregivers will treat you with the dignity and respect you deserve. Healthcare, at its core, is about one-to-one relationships, and that matters to all of us at York Hospital. As I step into my new role, serving as President and CEO, I promise we will always care for you with a friendly face and a compassionate heart.
And now, once again, thank you very much for tuning in today. We hope you find the information helpful and your time with us enjoyable. And we're pleased to turn the program over now to York Hospital's President and CEO, Dr. Patrick Taylor.
Thank you, Jean. and welcome everybody. Really happy to be here and spend some time this afternoon with you. I'm going to point out a few other highlights from my background, maybe to give you a little more insights into what has shaped me over my years, and the values and what drives me, and what will drive York Hospital in the days to come. I grew up in South Florida. I grew up in Miami, and grew up in what would be described as kind of a low-income family. And I point that out. I've been successful and blessed over the years, so I point that out certainly only to bring relevance to the fact that I grew up in that family where every month we worried whether you were going to meet the mortgage bill, or you're going to pay the water bill, or what you were going to do. And so I bring that sensitivity as I come to this community, in terms of especially the caregivers we bring on, especially our entry caregivers we bring on, and how hard it is to make ends meet on a week-to-week basis for them, and how hard many of our community folks struggle. That's something that I've always carried with me going forward. I was fortunate in college to go to Notre Dame, and while I could brag about Notre Dame, I'll spare that for some times when we get face-to-face and maybe on football weekends. But I will. The reason I point that out is because, as I stepped away from Notre Dame, it really instilled in me the values of always giving back to a community, and the values of service. And that when we are given wonderful responsibilities as leaders and talents, that you have to give back. That is part of the covenant that we share with the community and with each other. And so I hope that I bring that to this hospital in this community as well. And the other thing I will highlight is, in between my second and third year of medical school, I actually took a year off and spent a year in Southeast Asia. I was fortunate to get a wonderful scholarship from the Henry Luce Foundation in New York, and was in very rural parts of the Philippines with a couple of wonderful Philippine doctors. And, even though on a day-to-day basis, I see many community needs and many vulnerabilities in our community, we have incredible abundant resources here in the United States compared to the rest of the world. And so it's given me a different perspective as we face challenges, and also given me incredible encouragement of the things we can do with the resources we have been given here. I've been very fortunate over my career to have wonderful mentors, and I don't think any of us who have been successful didn't get to where we were without some great mentors, and a lot of people, pushing us and giving us incredible confidence, even when we maybe at times didn't believe we could fill the shoes that they had given to us. As the video pointed out, my most recent role was in Southeast Florida, and also did some consulting with a very large home health agency, and helped them through the pandemic, and dealt with very vulnerable populations, especially, as you know, when the pandemic really, really devastated our senior populations and those that were in nursing homes. And so a great sensitivity to the vulnerabilities of that group. My leadership philosophy, as I pointed out earlier, is one of service, is really one of servant leadership, which means I'm here to serve those that, are in my stead on a daily basis, to grow their talents, to bring out the best of them, so they can serve you in this community. Now, how did I get here? How did I get from Southeast Florida to here? I think some of you may have read some of this, but truthfully, you may not have known, but I now will tell you that for the last 20 years, you've been recruiting me. This community, I've come to this community with my family and friends over the last 20 years, vacationing, and whether it was the interactions at the Hannaford, or the interactions at the ice cream store, or the interactions at the bagel store, or just the interactions on the street and with community folks, it just was so welcoming. So you never know how those little interactions ultimately will lead. And I knew that this was just such a wonderful, welcoming, embracing community that fit who I was, fit my values, and so when the opportunity came up, that's why I took it on. Since I've been at York Hospital, I think it is a great gem. York Hospital is a wonderful, wonderful treasure to this community. And this is a wonderful community in which to serve. And there's a wonderful partnership, as I've grown to learn, between this community and this hospital. This past year has been difficult for our caregivers, for this community, and for our country. But as I stepped into the role over the last several months, what I've seen in our caregivers is an incredible amount of resiliency and an incredible commitment as they came through this pandemic, a commitment back to who they are, their purpose, and why they continue and why we continue to serve this community. I spent the last several months on multiple things. First of all, trying to make sure we're strengthening up many of our fundamentals, many of our fundamental metrics that really are the building blocks on which we will grow from here. Just making sure they are on strong bedrock. Those are our quality metrics. If we're going to provide service, I want to make sure that it's the highest level of quality and safety that we can deliver to this community. Strengthening our financial metrics. As I told you, I learned early. You need to live within your means, and if you don't have good financial metrics, it can really strain relationships and even strain an organization. So really been with the rest of the team and our caregivers really working on those. Our patient experience metrics. We want to make sure that we're delivering the care with dignity and respect that you deserve as individuals. And so really working on those touch points with each of you as you come in. And I appreciate all the feedback you've given. Many of you have either stopped me or written me letters or provide us feedback through our surveys. We take those very seriously. We read each of those. We share those at the leadership team. And, we make appropriate adjustments from the feedback you give us. So please continue that, and that's greatly appreciated. And then also strengthening our caregiver experience. So we want to make sure that those that are caring for you feel cared for by us in leadership, and making sure that they feel valued, that they understand that they are incredibly important to us and this community. I'm happy to say today we are stronger than we've been in quite a while. Still a lot of good work to do, but certainly all of those metrics are on the upswing. And so that's a great place to launch from. A few bragging points for York Hospital I couldn't get away from some. Over the last year in 2021, we were actually awarded the Outpatient Patient Experience Award from HealthGrade. That's the second year in a row. So we're the top 15% of this entire nation in our patient experience, how we interact with you. Still good work to do, and sometimes I would tell you we stub our foot, but we will continue to try to exceed all of your expectations. We were in the top 5 hospitals in Maine for our maternity care, and we look forward to continue to grow and achieve those type of accolades in all of our clinical services that we provide. I also witnessed as I came on board just this great enthusiasm throughout the hospital and folks that I interacted with for change, to look at what's best practice out in the nation. Not just what we've been doing, but what's best practice and how do we get there, and how do we continue to deliver excellence in everything we do. I visited all of our care sites, and we have a breadth of care sites in the community. And that's wonderful to see, so that we can deliver care where you are, trying to deliver it to you conveniently, with good access, and again, with great outcomes for you. So I've done a lot of what I call management while walking around, and I really embrace that philosophy. Just literally going on listening tours and breaking down those barriers between leadership and caregivers that should never exist, and just trying to be very responsive and kind of hearing what their day-to-day is like, and trying to ease any of those hurdles or burdens that our caregivers may have on a day-to-day visit. We started to, as the pandemic has started to recede, certainly in Maine, because we've done such a great job in Maine of vaccination, started to stand up a lot of our walk-in centers again. So we stood up Kittery again, we stood up our York Center, and Wells is operational at this point in time. So looking to continue to stand up our walk-in centers and stand up many of our support groups. Many of those transitioned to Zoom, and now starting to see how we can safely do those and start to do things face-to-face again. And I think all of us are yearning again to be face-to-face and that true human touch. So working hard on making sure all the programs and services that we once delivered on a face-to-face basis How do we get those safely back so that you can have access to those programs? I spent an incredible amount of time meeting with a lot of members of the community, as well as a lot of the members of local government, governmental members, and a lot of benefactors, all of which are very, very important to us. We're a community hospital. And as a community hospital, we really need to have partners with our community and with our benefactors. We couldn't do everything we want to do. We couldn't provide all the wonderful services that we want to provide without that partnership and that ongoing support from all of you. And so I'm grateful for all of you that have continued to support the hospital and lend your resources to ours. So that we can continue to grow and thrive and be a great foundational anchored institution for this community. And then most recently, together with the board, we have decided to launch upon a 3-year strategic plan. So we're going to spend the next multiple months, 4 to 6 months, really looking very, very deeply at all the services we provide, what's happening in our community, what's happening in Southern Maine, in Maine, what's happening with healthcare across the nation. Where are there gaps in healthcare, both locally and across the nation? And what services and what programs should we be able to provide? And what do we want to be 3 years from now? Where is it that we truly believe we can achieve excellence in this next 3-year time frame? And then put really, really detailed steps on how to get there. So that we continue to be an incredibly strong institution and partner for you when you need us. I appreciate this as healthcare is a very, very unique relationship. You come to us sometimes at your most vulnerable times, and that's something that we take very, very, very seriously. And we want to be here today and in the future, and we want to be here strong and able to meet those needs for this community. Additionally, I see, looking at our entire campus, looking at our technologies, looking at our facilities, and really reinvesting in all of those. And when we reinvest in ourselves, it's reinvesting in us, the community, because everything we reinvest, as you know, we're a nonprofit, so we're only here to serve. And so everything reinvest in the hospital is really reinvesting in you, the community. And so that's a significant part of what we will be doing and what we're starting to do. We also want to make sure that we can, over this 3-year time frame and going into the future, we can continue to attract and retain talent. We want to make sure that we can have great facilities, great services, great clinicians, and that this is where they want to grow their careers, raise their families in this wonderful place. And again, that requires an incredible amount of investment from all of us. So you can recruit them just like you recruited me, and we can recruit them as well. And so that's kind of where I see us going. I am really, really optimistic about the future of York Hospital. I'm really optimistic about the future of York community, the community that surrounds us. We will have many challenges, but we will have incredible opportunities to work together as well. And so I am, as the video started, I continue to be excited, proud, and really humbled to continue to serve with you and to serve this community with all of our caregivers, because it's far beyond me. We have 1,000 or so folks on a daily basis that truly are the caregivers, and they are the ones that have the ideas and the enthusiasm. And we just need to tap into that and bring all of those rich ideas together to continue to thrive as a hospital and a community. With that, I'm going to end my remarks, and I really would welcome and enjoy, some interaction in terms of question and answers. If I can answer it correctly, I will. If I don't have the answer, I'll ultimately get back. We will get that answer for you. So thank you for joining us today for this webinar, and look forward to hearing what's on your mind this afternoon. So, Jean, let's turn to our question and answer session.
Okay. Now, at this point, nobody has written to us yet. However, many of you were happy to provide us with some of your questions in advance via email, and I thank you for that. So I can certainly start with those. But for those of you still here that have not, feel free to type in your questions now as we speak, and we'll get to them next. A few questions were emailed to us in advance of today's webinar that had to do with the Living Well Center, the one located at Long Sands Plaza in York. Writers, all former and devoted members who use the facility regularly, understood the decision to close the center during the COVID outbreak. However, they are disappointed of the current decision to make its closure permanent, as they cannot find anything outside of home or in-home workouts to replace the expertise, equipment, and welcoming atmosphere that they experienced at the center. So their question is, under your leadership, Dr. Taylor, will York Hospital reopen the Living Well Center to general membership?
I've heard quite a lot about the Living Well Center. It's a question that's come up, probably one of the more common questions that I've encountered as I've walked around the community and interacted with many of you. And I know it was a very, very beloved program. The decision to close it, certainly because of the pandemic, but it was also, as we look going forward, it also goes back to my statement of making sure that with the limited resources we have, we make good fiscal decisions. That was a program that, although served an incredible amount of patients in this community, on itself could not sustain itself and cannot sustain itself. So that's a program where if we can find appropriate support for it, and we can, come together and find appropriate funding for it, I would love to stand it back up. It would make me nothing happier, because I appreciate the wonderful things that it was able to do. And yet at the same time, being very honest and very realistic. I think, as I said before, we have to make very, very prudent fiscal decisions. And it isn't just only about, we certainly want to serve in quality, but fiscal decisions so that we can continue to do everything we want to do, so that we can strengthen our future and grow. So there's probably more to come. That isn't the end of that discussion, but that's where we are at that point. And I hope that as honest as I could on that issue.
Thank you, Dr. Taylor. Okay, the next question was from someone who had a question about the cardiac cath lab. I've heard that there may be a new or renovated cardiac cath lab in the works at the hospital. Can you tell us any more about this?
Yes, we are currently going through an assessment of bringing some of the latest technology from a cardiac catheterization, and from the ability to implant pacemakers and automatic defibrillators for patients that need that, who have different types of arrhythmias. So yes, we are going through looking to bring in the latest technology into the hospital. Been working hard with our cardiologists, our cardiac team, architects, engineers. As you can imagine, in healthcare, there's lots of rules and regulations, appropriately so, to get through. But yes, ultimately looking to bring in the latest from a cardiac cath lab point of view. The timing on that, more to come on that. Literally just got an update this morning from our architect as we look to bring that project forward. We've also been fortunate to have part of that funded by a wonderful benefactor, but also, as we get the full scope of that project, may look to, additional support from the community to make that wonderful technology a reality for us.
Okay. The next question, the next writer says, I know you originally closed the Berwick walk-in due to COVID, and you moved the staff to other locations where they were needed more urgently. However, you've reopened Kittery walk-in, and I'm wondering if you'll be reopening Berwick soon. I'm concerned that its closure has become permanent.
That's one that really hopeful we will be able to bring back up. As I said, we've been very, very judicious of each of our walk-in centers that we've been able to bring back up. Each of them that we have brought back up, and most recently, even at our York and Kittery walk-in, have been well received and well supported again embraced by the community, which is very important, and have continued now or look like they're going to be successful. So again, Berwick is the kind of our last walk-in site that we're doing the due diligence of, not only what can we put in there from a walk-in, we already have the walk-in site, what other services that community needs, and what other services we can provide in that facility, because that facility has more space than just the space that we currently or had been using from a walk-in point of view. So that one I'm much more optimistic, and although I have a little bit of a timeline in mind, I don't want to overcommit, but that one I am optimistic that given everything we know at this point, look to be able to bring back up. Once I have the true timeline and dates, we'll get that out to the community as soon as possible.
Great. Okay, we actually had someone just write us, one of our attendees, and he asks, what do you see as the future of telemedicine at York Hospital? Has it been a success thus far?
So telemedicine, even though, as you know, globally, macro point in healthcare, telemedicine had started to get embraced. I think the pandemic accelerated telemedicine for all the right reasons, and allowed us to continue to care for patients safely during the pandemic. Yes, I do see telemedicine continuing at York Hospital. It is, at a national level, and when you read any of the trends in healthcare, it's certainly where healthcare continues to be. It allows patients to access us and our providers who may have transportation issues where it's not convenient. Now, it's not going to completely replace that one-to-one hands-on care, because many, patient visits and examinations require, one-to-one inpatient visits. Part of the challenge for telemedicine, again, seems like we always circle back a little bit to funding, but even when I spoke to, I had an opportunity to speak with our senator, and Collins, I let her know that we need to make sure that the federal government and the payers continue to support telemedicine. That hadn't always been in the past, and she's very, very supportive of making sure that they continue to fund telemedicine so that we can continue to, deliver this program. So yes, and the other wonderful thing about telemedicine for us here as a community hospital is that it allows us, and we've used this before, to bring in specialists from outside the area to opine, to give us some information with your physician live on maybe what a difficult case. So instead of potentially you having to go down to Boston or somewhere else because you have a fairly unique issue, we'll be able to literally have a consult through telemedicine with a consultant and bring that expertise here to this community and again, safely, conveniently deliver care in the community. And I think most people would prefer to have care in the community where they live. So telemedicine is here to stay, and I continue to see that continue to grow for us into the future.
Okay, thank you for that. The next question deals with mental health support. Whether pre-COVID, during COVID, or going towards post-COVID, mental health is a huge issue that continues to grow. Does the hospital have any official plans in play to support our community in a more substantial way than it currently does?
So mental health, if you look across the nation, and even certainly here at York Hospital, as I looked at our last community health and needs assessment, always rises to the top of one of the biggest needs of our community. That's, unfortunately, we're not unique in that. Mental health services just have not been as well supported, as not well funded as the rest of healthcare throughout the nation, and even locally. Totally support the need to grow our mental health services. We won't be able to do that by ourselves. This is going to require a true partnership, both amongst all of the healthcare providers in this area, as well as many of the other community services that provide support and for mental health. I literally had 3 issues because when you're talking to a senator from the United States Congress, you hit your 3 points, and mental health was one of the main issues I raised with Senator Collins. That, again, one of the issues that this community, Maine overall, I know, but this community needs additional resources to truly meet the needs of our patients and our community. We'll continue to do everything we can do on our part, but this is a massive issue for us as a community and even as a nation. Mental health just has been, in many ways backseated from a healthcare point of view. Not appropriately so, but that's just kind of been the way it has been. And so it will require significant change, even at the federal level, for us to truly meet the needs from a mental health point of view.
Okay, thank you. On to patient portals. Your patient portal situation for asking and supplying information has not been user-friendly for me. It seems that you have 2 or 3 different ones depending upon the place you visited or the service. Are you doing anything to fix this issue? Why can't there be just one?
Yeah, I would agree that, if in all honesty, probably our patient portal is a bit clunky to describe it at best. We do have 2 different systems. Part of that is because we run, not to get too technical, but we run 2 different platform software systems. One is for our outpatient, so our physician practices. So when you visit any of our physician practices, the software program where they put in all their notes and the lab results and everything that goes along with your visit there is on one software platform that was made for supporting physician practices. And then you have the platform when you come into the hospital, different software platform. Those 2, like pretty much all healthcare software packages, not just here at Hope York, but across the nation, those 2 do not interface very well. They don't talk to each other very well. So we ended up having to run 2 separate portals into them to let you access your information. Long term, that this is part of what I spoke about in terms of reinvesting in terms of technology into this hospital. We will need to get to a better and what I call a more common healthcare system, electronic medical record. So one software platform that covers everything from an inpatient to outpatient, no matter where you enter our system, that you will be able to access your healthcare record and be able to get information out of that. That is a literally multi-million-dollar investment to get to that level of integration, but it's something that we need to do over time. And although we will have some dollars we are investing next year, and so it may be a little faster and a little smoother, a little easier for you to get the information. It will still be 2 systems, but ultimately, in terms of what I spoke about, our 3-year strategic plan, that is one of the major, that will be, I'm sure, one of the major goals that come out of that is to develop a fully integrated healthcare record for all of our community. So high on the list, high on the radar, absolutely.
That's great. Now the next patient that wrote in said, I am a patient at one of your practices, and depending upon the day, I have a lot of trouble reaching an actual person. Sometimes it's a long recording. Sometimes I get put on hold for 20 minutes. Does this happen with all of your practices? It's very frustrating and often enough to make me consider switching to a different practice.
Well, first of all, please don't switch to another practice, because I like to believe we deliver the most, compassionate, dignified care and the highest level of care for you. I can appreciate the frustration on phone systems and phone trees. We did implement, over the last 4 to 5 months, we implemented a new phone system in our physician practices and working out a lot of the bugs. I think we continue much better today than it was several months ago. And as I've continued to, again, these are when I referenced before that we actually listen to your feedback and look at your surveys that you send back. I can see that the level of any issues we've had with the phone tree, while it's not perfect, it's significantly decreased as we've learned the new phone system. Kind of worked out a lot of the kinks. Ultimately, the system was put in place so that one, it would actually be easier for you to access us. Two, to upgrade technology. Again, phone systems are incredible investments in technology. They aren't what they once used to be, just in simple phones. There's an incredible amount of technology that goes behind them. And so if you're still having lots of challenges, I want to hear about that, because from what I'm understanding, what I'm seeing, we do have some secret shoppers and callers, and when I've even called some of our offices and not push the back line, not try to trump any of the lines, and just do it like any other patient, it's gone fairly smoothly. So please let me know if you're still having a lot of bugs out there, because we understood that and tried to respond to that.
Okay, great. Now, thank you for sending along another question to us, one of today's attendees. Is there any plan to improve the overall internet service at the hospital and the entire campus?
Yeah, internet, I will tell you that internet at the hospital, when you're at the hospital, can be at times spotty, depending on where you are. So yeah, we continue to put drops into the hospital to improve our internet service. Having said that, there are a few limitations. And again, I'm not trying to make excuses, just reality. One, sometimes depending on where you are in the hospital, because of shielding and lead walls and things of that nature, when you're around x-ray and cath labs that are all shielded in lead walls, internet service and even the number of bars on your phone will be significantly down. That's probably not something we're going to be able to totally work out. That part of that just because of the safety we need from a patient point of view. The other thing about internet at the hospital, and just in not poking at York, the community in general, as you know, even when you drive around here, there are significant drop spots. That's one of the beauties and one of the challenges I used to always face when I came up here to vacations. It was the one time when I was away that I would tell my assistant that you may not be able to reach me right immediately. I'll eventually get your call or your text or your message, but depending on where I am in this community, I may or may not have the best reception. That sometimes is a wonderful thing when you're on vacation. I appreciate when you're living here and trying to do business and access family and friends, and in the hospital, that's a challenge. So yes, not to make light of it, that isn't our internet service within the hospital. We will upgrade that as well as part of the technology package as we move forward.
Okay, great. Now, just a heads up to everyone, this is the last question that was sent in prior to the webinar, excuse me. So if you have something that we haven't covered, feel free to start typing now. Okay, this one has to do with the Northeast Rehab Project, Dr. Taylor. Following the considerable red tape York Hospital cut through in order to get the Northeast Rehab facility approved, I'm wondering when or if it will ever move forward. Do you have a timeline? It's truly needed in our area.
Good question. One of the major project that was paused and put on hold, partly because of the pandemic, partly, honestly, because of the ability for us, York Hospital, to take that project on at what we were facing through the pandemic and kind of the financial position the whole pandemic and everything has put us on in terms of taking on that magnitude of the project. At this point in time, that project continues to be, on hold. I do not have, further information beyond that at this point in time. Really been focusing, as I said, not that that's not important, but really been focusing, as I made mention in my earlier remarks, on really getting the fundamentals, building that foundation so that we can take on other projects and growth. But to take on a project of that magnitude without a very, very strong foundation, both financially and also having all of our team focused where they need to be focused, because that project requires significant leadership even from the hospital to bring it to fruition. Just can't take that on at this point in time. Wish we could, but at this point in time, really need to just work on a lot of our great fundamentals, like I said, which are in proceeding wonderfully at this point in time, but we're not ready to take that off hold.
Okay. Well, in that time frame, nobody seems to have any other questions. So I will ask Dr. Taylor, did you think of anything along the way that you might have forgotten and you want to put in now?
No, I mean, I will just reiterate that it is a partnership between us and the community. And we want to make sure that we are a good partner for this community, that we fulfill the needs that happen in this community. We won't ever be able to be everything to everyone. I wish we could, but we have to be good stewards of the resources we're given. We need to make good, prudent decisions so that we can be here for you in the future. We can remain a strong anchor institution into the future. Sometimes that means that not everybody will get everything they thought we needed in the community, but hopefully what we are able to deliver is top level from a quality, from a safety. It really is reverent. It really continues to be a hospital where you are treated as an individual, where you are respected as an individual, where you feel very comfortable coming here, because it really is, hopefully you see it as family and friends taking care of family and friends. That's how I see our responsibility. And when you're taking care of family and friends, you rise to another level. And so that's the commitment, that's the level of responsibility that I appreciate we and I have to deliver to all of you. And we take that very, very seriously. But also wanted to leave on the note that I'm very, very positive and very, very enthusiastic about our future together. There are many things that will come of that strategic plan that we haven't touched base on today. There are many exciting plans for additional growths and reinvestment that you will hear about as we come out of that strategic plan. And many of you in the community will be involved in that, because it isn't just a plan that we will develop in a silo here at the hospital. We will involve many community members and many listening posts to make sure we're responsive to your needs and that we are delivering care the way you want to get it. We take this responsibility. It is truly, in my world, a sacred relationship between us. And so I want you to know that. I want you to continue to reach out to me and to give us feedback, because that's what we need to do to be good partners. And so I welcome that. I welcome getting to know more and more of you along the way. And so thank you for taking the time and time out of your schedule today just to spend some time with me and with us. And look forward to, again, the time when we can meet face to face.
Wonderful. And that brings us to the close of today's presentation. We're excited to have had the opportunity for you all to meet with Dr. Taylor, at least virtually, to hear his plans and strategies and intentions for the hospital. And we hope it was both enjoyable and educational. So now if you happen to see him in the halls of the hospital or at Hannaford or walking the beach, please don't hesitate to reach out and introduce yourself as well. And with that, thank you for coming and do enjoy the rest of your afternoon. Bye-bye now.
Bye. Thank you.